So today I want to talk about the difference in perception when you use the word and rather than the word but when you're talking to a patient. So let me give you an example. I've got a patient who has got a musculoskeletal back problem, but they're really pushing to get a back x-ray. Now, clinically there's no indication for a back x-ray. There's risks to having a dose of radiation. You need to have a good reason to send them for that. As the problem's muscular, there's no evidence of a fracture. You're not going to find anything, are you? Now, in how you explain that, it can change how the patient receives or responds to that information. So if you say, I know you really want to have a back x-ray, but, now whatever you say after but, it can be based on research, it can be evidence-based. Patients often, they just shut off because it sounds defensive. What they've heard is, but, right, now you're going to tell me something, you're going to fob me off, but I don't want to refer you, you're making it personal. Can you see, we talked about this in a previous video. Look what happens when you use the word and. So I know you're really keen to have a back x-ray, and I can understand why you would want that, because this pain is really affecting you, it's affecting your ability to do your work. You can't lift, and that's an important part of your livelihood. And I'm really glad that you've come in so we can discuss it. Thankfully, from the history and from examining you, this looks like a problem in the muscles. And that's not something that would show in an x-ray. And I'm sure that you wouldn't want to have a dose of radiation for no possible benefit. What can be really helpful is if we talk about the type of painkillers that in combination can help not just the pain, but the swelling in your muscles and the ligaments. And if we add to that some exercises that will help keep your back from getting stiff and get you moving, hopefully we can get you back to work sooner rather than later. How do you feel about that? Can you see the difference? When you're using and then you can add something to it, okay? You're acknowledging that you've heard what they say and you understand where they're coming from and you want to do something about it. You're focusing on what you can do. You're focusing on the positives. The minute you use the word but, often the patient will shut down. So, and, not but, okay? And you can then lead into what you have knowledge of and what you have control of and what you'd like to steer the consultation towards, ultimately for their best interest, okay? Hope that's helpful. Do subscribe if you want to get the next video in this series.